Greetings, Huma 30 stress management class. Today, this is lecture number 11. We're moving right along. Lecture number 11. As always, I typically start off with that outline. And just as a reminder, I would like for you to just continue doing a great job of taking notes. Without further ado, lecture 11. In lecture 11, we are going to cover autogenic training, the benefits of autogenic training, how to do autogenic training, right? And autogenic training experience and progressive relaxation. So, what autogenic training is, it's a relaxation technique that involves imagining one's limbs to be heavy, warm, and tingling. This is a sensation of heaviness. So you'll hear meditation instructors asking you to let limbs go limp. Imagine them being heavy. This is caused by muscles relaxing. Okay, generalized warmth. What that means is the function of the dilation of blood vessels resulting in increased blood flow. It's also designed to help people better manage the stresses in their lives. Uses bodily sensations to first relax the body and then expand this relaxed state to the mind by the use of imagery. It has a physiological and psychological benefits, and we'll talk about those in this chapter. The physiological effects of autogenic training: it decreases heart rate, respiratory rate, muscle tension, serum cholesterol level. It increases the alpha brain waves, the blood flow to the arms and the legs. The health benefits of autogenic training is it improves the immune function of cancer patients. It enhances the quality of life for those with multiple sclerosis. It helps relieve headaches. It assists in managing the symptoms of Parkinson's disease. It aids women to alleviate menstrual discomfort. Helps those with scoliosis and dyspepsia. It aids insomniacs to sleep. It treats substance abuse, relieves pain, decreases tics associated with Tourette syndrome. So it has a number of benefits. The psychological effects of autogenic training are increased ability to tolerate pain, reduction in anxiety and depression, decreases in tiredness, control of obsessive gambling, increase in resistance to stress, prevention of injury in athletic performance. The factors essential to successful autogenic training have to do with high motivation and cooperation, a reasonable degree of self-direction and self-control, the ability to maintain a body posture, reduction of external environmental stimuli, concentration of attention on bodily sensations. The 6 stages of autogenic training focus on heaviness throughout the arms and legs, warmth throughout the arms and legs, sensations of warmth and heaviness in the heart, slow and calm breathing, sensations of warmth in the abdomen, sensations of coolness in the forehead. And this is an introductory training to autogenic. You can take a deep dive. There's also YouTube videos on autogenic training. In terms of imagery, images of relaxing scenes to translate body relaxation into mind relaxation. Autogenic meditation, visualization of relaxing images used during autogenic training. The phases of autogenic meditation: rotate your eyeballs inward and upward towards your forehead. Practice visualizing one color. When you visualize, colors into pictures, abstract ideas, people in vivid scenes with smells, sounds, colors, sensations, and taste. The health benefits of imagery: decreases the frequency of headaches, reduced pain, experienced by chronic pain sufferers and children in hospices. Right? Aids better sleep and decreases PTSD, post traumatic stress disorder, severity in sexual assault survivors. Helps older adults who have mild or moderate depression. Reduces anxiety and depression among breast cancer patients. Decreases the urge to gamble. Bracing. This is a term which refers to unnecessary muscular contraction. The proper form is moving the body to accomplish the task most effectively, right? It interferes with the proper form and results. And it results in inefficient energy expenditure, headache and backache, pain in the neck and shoulders. Bracing continues. So it can lead to other illnesses, can be a reflex reaction, and it can happen without realization. Grasping the steering wheel tightly, right? Or holding the pen or pencil tightly while taking notes. Gripping the arms of a chair while visiting a dentist. This is reduced by progressive relaxation. Progressive relaxation is used to induce nerve muscle relaxation. It involves contracting and relaxing muscle groups throughout the body. This is called the neuromuscular relaxation or Jacobsonian relaxation, right? These are the different terms, the neuromuscular relaxation or Jacobsonian relaxation. So lastly, it relaxes the mind by first relaxing the body and does not produce a hypnotic state. The physiological benefits of progressive relaxation. This relaxes the smooth muscles, which relaxes the gastrointestinal and cardiovascular systems. This is effective in treating headaches, backaches, side effects of cancer, insomnia, pain, and high blood pressure. It alleviates conditions resulting from bracing. The psychological benefits of progressive relaxation: reduction in depression and anxiety, better sleep for insomniacs, decrease incidence of alcoholism, reduce psychological distress among heart failure patients, improvement in athletic, academic, and musical performance. Performing progressive relaxation continued. First sign is to recognize the signs of tension, right? Seek an environment that is free of distractions and remove items that would constrict or make you feel uncomfortable. Find a comfortable body position. Choose from variations of muscle relaxation exercises. And again, you can find examples of progressive relaxation on YouTube, on Google. Sometimes having a visual in combination with the definition of the theory and how to apply that theory is really helpful. So check out figure 11.5 where it demonstrates muscle tension and the different relaxation exercises. This is a good opportunity to pause the video so you can look at the tightening of the calf muscles by pointing the toes, right? That's figure A. And figure B, the young lady has raising the shoulders in a shoulder stretch. C is tightening different facial muscles, and D is stretching the neck muscles. Now, some exercises that you can practice at home is trying to perform autogenic training for 24 minutes, right? 6 minutes each exercise. And that could be something like holding heavy books, covering your hands and feet. This is something that we kind of inherently do naturally, right? Running in place, practicing rapid breathing is something that we have done in meditation, using a hot pad, or it could be a hot water bottle, right? We call this solar plexus warmth. Placing a cold cloth on your forehead. We do this when we have a fever, right? You can also try to imagine the sensations produced by each of those exercises and note the change in your level of relaxation after you release, right? Something that other people do is they try to develop an image that you find relaxing by completing the guided questions. And you can find guided questions online, right? I encourage everybody to Google autogenic meditation. You can use your own language, and when you create these types of guided questions, get involved in your community by volunteering to teach autogenic training to groups after you have mastered this. Okay, if you have a friend, relative, brother, sister, cousin, or your partner, you can hold hands between the thumb and the forefinger, right? Getting them to relax. Shake hands gently, and then let go. Right? See what happens when your muscles contract versus when they relax. This is all about getting your muscles to relax. It's a good idea to also practice progressive muscle relaxation as we talked about in this chapter. Okay. And then if you really want to nerd out with this, I know a lot of you are like, no, I don't want to do anything extra. But if this is something that you feel like could really do a good job of alleviating stress, write an essay about the instances in which you done bracing, right? Was it beneficial? Right? You want to talk about when you did it and why. Were there physical effects associated with bracing? All right. We are all works in progress. So we have to do what we have to do in order to practice different techniques that we feel like can be lifelong, that can reduce stress. It's not just the mind, but it's also muscle tension that we may experience throughout our body. So when we talk about autogenic or progressive relaxation techniques, this isn't something that is in a vacuum. This isn't something that you can master in one day, but it's maybe something that you would like to practice. And if that practice is ongoing, you're going to be better off than most in reducing certain muscle tensions that are associated with stress. All right, this is lecture 11, and we only have 4 more to go. Take care, everybody.